please explain how common adenomyosis is?
Yes, actually, adenomyosis is more common than we think. And we are realizing this last maybe 3, 4, 5 years. Why? Because we become more aware of adenomyosis, and because the imaging, the modality is improved a lot, like doing MRI or deep pelvic scanning. So, essentially, unless you have a high level of suspicion, you may see uterus with adenomyosis, and you may not diagnose it. But once you start investigating uterus properly with a deep pelvic scan using Musa criteria or MRI, then you can diagnose better. So generally, we don't know exact statistics. Like endometriosis is very common. Maybe 15–20% of women have endometriosis. We think adenomyosis is similarly common. May not be as common as endometriosis, but fairly common. We don't know exact statistics, but in couples, in patients who have infertility, adenomyosis is very common. Maybe 15–20% of couples with infertility have adenomyosis. 25–30% of patients who is undergoing IVF have adenomyosis. And a lot of patients, maybe most patients who have a repeated implantation failure, which means failed embryo transfer of 3 or more high-grade embryos, have adenomyosis. Why? Because by far the adenomyosis is the main cause of repeated implantation failure. So so this is why if patients have the symptoms of adenomyosis, it is important to have a more in-depth investigation. Usually that involves doing a deep pelvic scanning using Musa criteria.